Good morning, everyone. I would like to thank Dr.
Dr.
Shrikant.
Tanvi is from Chitrakoot again, and she's working in Mumbai at ASG Hospital. Dr. Tanvi, please.
So I would like to thank Dr. Shrikant and Dr. Kamaljeet sir for this opportunity. So today I'll be talking about focal and grid laser. Uh, So if we talk about focal laser basically targets on a focal lesion like microaneurysms, some intraretinal microvascular anomalies, yeah, capillary leakage, focal leakages. So it is intended to directly seal the leaking vessels. And when we talk about grid laser photocoagulation, so it is performed in the non-center involving areas of macular thickening with diffuse leakages or some areas of capillary losses. So the burn are spaced one burn apart in a grid pattern laser. The end point of the burn should be just grayish. When the burn turns grayish, that is moderate burns. We should avoid foveal avascular zone while lasering during grid laser photocoagulation. So this is just a graphical presentation. As you can, my pointer is not visible, sorry. So in the first picture, we can see that those black dots represent the focal laser, and here is the grid pattern laser. So if we talk about the indication and clinical application, the focal laser usually done in DME, and we laser the microaneurysms in diabetic macular edema. And in grid laser, we do laser in diffuse macular thickness, but obviously we avoid lasering FAZ. So other uses are also there like BRVO and some CSCR which have point leakages, and also selected cases of retinal vascular anomalies like hemangiomas. So when we talk about mechanism, actually it has been very well explained by Dr. Kamaljeet sir, but still there are two effects. One is thermal effect, another is secondary effect. So thermal effect, when we talk about, the heat does protein coagulation, which directly seals the leaking vessel. And when we talk about secondary effect, so secondary effect may it basically work on RP pump function, and cytokinins are released, which eventually reduces the VEGF production, which leads to retinal tissue remodeling. So laser parameters, although it has been told by Pranav, but I'll be just going through it. So when in focal laser, the spots are little smaller compared to grid laser. In focal laser, we just do the blanching. So the duration of the laser is 0.05 second to 1 second. Power is titrated in such a way in focal laser that there should be only blanching. We do the delivery in both the laser system by slit lamp photocoagulation using contact lenses, and laser is used, green laser with frequency of 532 nanometers. So when we plan the treatment, we have to do few investigation like fluorescein angiography to just locate the leakages point. During diffuse or grid laser, we just do OCT to just locate the retinal thickening. So clinical outcome and benefits, it is obviously durable, it is very durable and anatomical effects. As per ETDRS and some other studies also, it has been shown that it reduces the moderate vision loss by 50%, and obviously it is very economical. And it has been seen that eye after focal or grid laser keeps improving even without any additional treatment. Laser remains the effective treatment in non-center involving DME. So what are the advantages? It is obviously a long-lasting effect compared to the transient effect of anti-VEGF, lower cost, and when it is combined with anti-VEGF can reduce the injection frequency as well. There are potential complications as well. Sometimes if the laser are not done properly, so expansion of laser scars can be there. There can be development of some central scotomas. Night vision issues can be there, and rare instances of coronary vascularization has been seen. So we can mitigate these issues by just using modified lower intensity laser burn. So, to conclude, focal and grid laser are proven techniques for managing DME and other retinal vascular issues, but it requires precise techniques and patient selection. Laser continue to have a vital role even in era of anti-VEGF. Role has evolved but not disappeared with anti-VEGF. These are my references. Thank you.
This BRV, as you all know, we have already discussed scatter photocoagulation and grid photocoagulation, and Dr. JAIN has done a wonderful job.
Thank you so much.
And so, thank you so much, Dr.